Hi, thanks. Welcome back, everybody. We have Kelly Klein in with DMH. Thank you. And yeah. So thanks for coming in.
You're welcome. Not a problem.
Just wanted to know if you'd like the thoughts on Department of Mental Health and on this bill, whether this is needed,
Yeah.
how it would, if it would work in practice.
So the first thing I want to address, which is a more clerical issue, I think, is that when we were reading this, what is stated as 7110 as requiring a board certified or board eligible psychiatrist or a resident in psychiatry really refers to 7508, which is the second certification process. So just to really clarify that point, that 7504 is the first certification, which requires, right now, it says a physician or designee, not a board certified or board eligible psychiatrist. And in practice, that is what we follow as well, which is the second certification is required to be done by a board certified or board eligible psychiatrist or a resident in psychiatry, versus the first certification can be done by a physician or a designee, which per the 26 VSA can be an APRN as well at this time.
Yeah, go ahead.
Are you suggesting we need to change 7110?
Something needs to be edited.
Okay.
Yes, to make sure that it is aligning, because the bill proposed is for first certification, but that language specifically about the board certified, you know what I'm saying? Okay, thank you. Yeah, that specific part is for second certification.
See it?
What line are we on? Is there a line?
Yeah, page 1
You're in the right, it's right in
and
there.
13, 14.
Yeah.
Thank you.
We'll get clarification from our council.
And so right now we do have the capability for nurse practitioners, APRNs, to complete the first certifications. They still have to go through the designation process with the Department of Mental Health. I think, addition to this would be if a physician's assistant could also do that process, which we are not directly opposed to. However, the part of statute that allows APRNs, the nurse practitioners, to do this is the 26 VSA, which says that they can sign anything that a physician can sign. And that's where physician assistants have not fallen under that in the past.
So that's on the next page. Well, I think I'm a little confused. Is everybody else?
Been too.
confused?
Okay,
Right now, you're not following statute then.
yes, we are. We go under the 26 VSA, which allows APRNs too. We do not allow physician assistants to sign it because they are not encompassed in that 26 VSA as statute reads right now.
Okay, but so
Oh, I'm sorry, go ahead.
you're saying right now it reads that a board eligible psychiatrist has to complete the first certification.
It doesn't read that. That's just in this proposed bill. It says that. Or there's an inconsistency in the statutes,
Yeah,
which that part I'm not.
that piece I think we'll pick up with Dutch Council
Yeah.
in another conversation.
Yes.
Can you just speak to the change of the
Expanding to.
the addition of the APRNs?
So the APRN is already included in our first certification designation. They're already PAs are not. We would be opposed to the addition of physician's assistants being included in the statute as it reads at this time, unless there's a requirement for additional education, because APRNs have specialized education more specific to psychiatry if they're in that work, versus physician assistants, it's a more broad training. So we would just request that if this does go through, that we have the ability to provide enhanced education.
Wouldn't an APRN working in an emergency department have not necessarily any more training in this, because remember, this is a certification to essentially rule out a medical condition. unless they are a psychiatric nurse practitioner,
Right.
which in an emergency department would not necessarily be a psychiatric. In fact, it probably wouldn't be. It would
Right.
just be a
Yeah.
generalist, which would be the exact same as a physician assistant, not the exact same, I realize.
Right. And the training hours is different as well. And so they do receive more specialized training as they go along. APRNs, yes.
Okay, go ahead.
I think it's a scope of practice issue, that if we included that, and there's no
Right.
language in here about scope of practice, but included that, we could say that APRNs whose practice, scope of practice is approved by OPR to include psychiatric blah, blah, whatever, and the same might apply. Well, then it would go through the medical board,
Right.
PAs, which is a whole nother land.
Would a physician assistant be able to treat in a voluntary person coming into the emergency department? Who's coming in for?
Yeah, and they can still treat an involuntary patient as well.
And
Yes.
It's not about treatment, though, it's about certification.
From what I understand, it's about certification to then move to the next level of certification by a psychiatrist, which really that certifier is ruling out whether or not this is a condition caused by a mental health diagnosis and eliminating any differentials for, say, I mean, just like delirium because of a medication,
Substitutes.
so- well, I
No,
mean,
with that.
it could be anything.
They may or may not be.
I mean, yeah.
Yeah, they may or may not be, because the way that the first certification actually reads, it does not require that they've completely ruled out a medical condition as of yet. What it states is that there has to be a major mental illness, and that major mental illness has to be directly causing the dangerousness. And it goes through a section where it asks if a lower level of care is appropriate, and that includes voluntary admission. So the big part of this is making sure that anybody doing the first certification can do diagnostics, obviously, which physician's assistants absolutely can. They also can determine the dangerousness. And if they have the capability to do admitting within their hospital, so admitting privileges throughout any hospital would be necessary in order to do the first certification, to do that last part, which says this person requires admission, I can make that decision, and that they're not appropriate for a lower level of care.
But also they have to make a determination whether or not it's being caused by their mental
Correct. Yes.
illness, not any other illness.
Yes. Yes. That's every part of it, though, too. That is also the warrant should be saying that. The first certification and the second. So all three independently have to be saying that.
Any questions other than, I guess I'm still not clear. Other than various things around the language, which we can work with legislative counsel on,
Yes.
from a policy standpoint, does the Department of Mental Health support this changed policy or not support changed policy?
The Department of Mental Health does not support the change that includes the other health professionals, but I think that was taken out as of now. But just to be clear, we don't
Physician
support that.
assistants.
For physician assistants, we support the change so long as it's broad for healthcare in general, that they are able to do the same signing as physicians. The Department of Mental Health does not believe that it is appropriate to change it just for mental health.
Do you need additional language in the bill in order to support the bill?
Yes,
Could you provide that language?
we could. I would need to go back to our legal folks and see what they would recommend specifically. But yes, if we had further language that allowed physician assistants to also sign in the same way that APRNs can within our current statute, then we would support the bill.
And you're talking about in Title 26? Yeah, okay.
Any other questions? All right, thank you.
Yeah.
So I'm assuming Liz is not here yet. Okay, sorry, we're having a little, we have witnesses that can only come in at certain times, so we're